Understanding sodium and glucose. The osmotic connection. Sodium and glucose are two critical components in our bloodstream, each playing a vital role in maintaining our body's homeostasis. Sodium, an essential electrolyte, helps regulate fluid balance, nerve function, and muscle contractions. Glucose, on the other hand, is a primary energy source for our cells. But how do these two seemingly different molecules interact? Let's dive deeper into their osmotic connection. Under normal conditions, sodium and glucose are balanced in the bloodstream, maintaining stable osmolality. Osmolality refers to the concentration of solutes in the blood, which is crucial for the proper functioning of our cells and organs. When sodium and glucose levels are within their normal ranges, the osmolality of the blood remains stable, ensuring that water distribution between the blood and cells is balanced. When blood glucose rises, especially above 200 mg/dL, it increases the blood's osmolality. This rise in glucose levels can occur due to various reasons, such as uncontrolled diabetes, excessive carbohydrate intake, or certain medical conditions. As glucose levels increase, the blood becomes more concentrated with glucose molecules, leading to a higher osmolality. This means there are more glucose molecules in the blood, making it more concentrated. The increased concentration of glucose in the blood creates an osmotic gradient, where water tends to move from areas of lower solute concentration, inside the cells, to areas of higher solute concentration, the bloodstream, to balance the osmotic pressure. To balance the osmotic pressure, water moves from inside the cells into the blood, diluting sodium in the process. This movement of water is a natural response to the osmotic gradient created by the high glucose levels. As water leaves the cells and enters the bloodstream, it dilutes the sodium concentration in the blood, leading to a condition known as dilutional hyponatremia. This shift of water from cells to the bloodstream causes what's known as dilutional hyponatremia. Dilutional hyponatremia is a condition where the sodium levels in the blood appear lower than they actually are, due to the dilution effect of the excess water. This can lead to symptoms such as headache, nausea, confusion, and in severe cases, seizures or coma. To understand the true sodium level, we use a correction formula. Corrected Na+ equals measured Na++ 1.6 times the difference of glucose and 100 divided by 100. This formula helps healthcare professionals determine the actual sodium concentration in the blood, accounting for the dilution effect caused by high glucose levels. This helps us account for the dilution effect caused by high glucose levels. By using the corrected sodium formula, we can get a more accurate picture of the patient's sodium status, which is crucial for proper diagnosis and treatment. So, when glucose rises, sodium may appear low, not due to loss, but due to fluid shifts. It's important to recognize that the apparent low sodium levels are a result of the body's attempt to balance the osmotic pressure, rather than an actual loss of sodium from the body. This is called dilutional hyponatremia. Understanding this concept is essential for managing patients with high blood glucose levels, as it helps prevent misdiagnosis and ensures appropriate treatment. Copyright 2025.